Which areas should be assessed for fluid on an MSK ultrasound exam of the knee? The answer is the suprapatellar and parapatellar joint recesses. First, place the knee in 20 to 30 degrees of flexion. The suprapatellar recess should be evaluated in the long axis from medial to lateral, showing the entire suprapatellar recess. Like in this example, you can see the full extent of the fluid collection. And then you also want to scan it in the short axis from distal to proximal. And when you turn 90 degrees on that, you can switch to a trapezoid view to see the full extent of the fluid collection. And then you always want to take a color picture using the most sensitive Doppler on the system, and that's what we're seeing in this example. The scan technique for imaging the suprapatellar recess is to place the transducer over the superior aspect of the patella. You'll be long axis to the quadriceps tendon. The suprapatellar recess will be visualized deep to the quadriceps tendon. And then you want to extend your scan to include the lateral and medial sides of the quadriceps tendon in your images. Fluid is dependent in a supine position and can tend to accumulate in the lateral and medial parts of the suprapatellar recess. Due to the mobility of fluid, it's important to sweep through all the areas where fluid may accumulate. When there's excess fluid in the joint, it may also show up in the gutters alongside the kneecap, deep to the retinaculum. This area is known as the parapatellar recesses. To assess these pouches, the transducer should be placed in a transverse plane, like in the images shown, over the lateral and medial edges of the patella. Dynamic scanning while squeezing the lateral or medial sides of the knee with the non-scanning hand may be helpful to move fluid into the space that is being imaged. The knee joint should be inspected for any joint effusion or synovitis present. When the fluid has a complex appearance, it's important to be able to differentiate between effusion and synovial thickening. Power Dopplers should be used to detect the presence of hyperemia, which is indicative of synovitis. If the collection is compressible with transducer pressure, then this confirms that the fluid is not synovial tissue, confirming a diagnosis of effusion. To learn the scan techniques necessary to perform these exams in a clinical setting and also earn 16 CME at the same time, join me next month for the most comprehensive MSK ultrasound course of the year. You can get more information on my website, www.learnmsksano.com. Grab your seat today.